When I was in your office recently, I see a lot of like a really varied patient population. Can you kind of run us through some of the most common conditions you see throughout these different populations?
We see the whole demographic of patients, from babies to teenagers to adults to elderly patients. So, babies, when we see babies, they usually come in referred from their pediatrician for stubborn atopic dermatitis or eczema that they're born with, that the pediatrician is managing, but they want secondary help with the management of topical steroids because you don't want to use that for too long. We see babies. What else? Sometimes birthmarks. The pediatrician wants us to evaluate and make sure everything is okay. Then kids, we see tons of warts and molluscum almost every day. So molluscum is kind of like the cousin of a wart. It's another virus that can cause certain bumps all over the skin. We see, what else do we see in kids? Yeah, eczema in kids as well. And then onto teenagers, we see a lot of acne, also warts. And then more in the younger demographic, we start doing our mole checks, skin checks. Patients come in with a family history of melanoma or just a lot of moles that they want evaluated. So I take a look and make sure all of them look okay. And if there's suspicions, once we biopsy them. And then, as you get into like 40s, 50s, then some of these patients start developing skin cancers, especially if they're from the generation that wasn't wearing sunscreen. So those are patients that become our surgical patients, where we're always cutting out their skin cancer before it gets out of hand. And then the elderly, mainly we do a lot of skin checks on them too. So as you age, you start developing a lot of growths. Fortunately, a lot of them are benign. There's growths called seborrheic keratoses, which are kind of these warty-like bumps. A lot of patients, when they get their first one, they get worried and they think it's skin cancer, so they come right in, but there's a lot of reassurance. And then a lot of patients have precancerous lesions called actinic keratoses, so that we use something called cryotherapy or liquid nitrogen to freeze them and treat them and prevent them from progressing into skin cancer. But yeah, it's just to recap, we go from eczema and birthmarks in babies to skin cancers in adults and elderly. So we see the whole gamut. And of course, in between, there's the cosmetic aspects of Botox, fillers, lasers, just anything patients can do to improve their appearance too.
And you mentioned a few times that a lot of patients are coming in with unrealistic expectations for their skin clearing, or I guess like the laser or the Botox. What does that conversation look like to try and manage their expectations?
Most of the time it's harmless, it's fine. They want, let's say they just want their acne cleared right away without using chemicals, a lot of patients will say, or so they don't want to do like Accutane or oral antibiotics, which is fine, but they expect their cream to clear their acne. But sometimes acne creams can irritate the skin even more, so it becomes the cycle. What else? Or patients come in with 20 different lesions, they want them all removed and treated, and they want no scarring at all, but we have to set the expectations. Hey, there is going to be small scar. And I personally, if a patient comes in for a cosmetic mole removal, I won't do it if I think the scar is going to look worse than the actual mole. So we do have to set that expectation. But in our practice, we've been around my brother started the practice about 20 years ago now. So we have, we know the patients in the area for the most part. So patients come in and we have a good reputation. So patients come in with a positive attitude for the most part.
Thank you so much for listening. I hope you enjoyed. If you don't mind, please leave a like and subscribe. And with that being said, see you in the next one.